Hello guys, welcome to part 2 of our Anti-Psychotics. Anti-Psychotics. So what we know now, what we already know is that antipsychotics are divided into two. So we have first generation and we've got second generation antipsychotics. And we did say that these are also called the typical antipsychotics. And the typical antipsychotics are also or are further divided into high potency and low potency. High potency antipsychotics they've got a much increased risk for extrapyramidal side effects. They've got a lower affinity for these other receptors, your histamine, muscarinic, and your alpha-1 receptors. Obviously, these are more potent than these ones, so they are much more strong. So their effects are much more pronounced, right? And on the other side, these drugs, their risk of EPSE is reduced, but the issue, these drugs have got high affinity for histamine and muscarinic receptors, the alpha-1 receptors. What I want you guys to get is that these drugs do not only block D2 dopamine receptors, they also block these other receptors, because that's where our side effects are coming from. You see, these three receptors are not dopamine receptors. So on top of them antagonizing dopamine 2 receptors, they also block histamine, muscarinic, and your alpha receptors. And we did mention that the most common drug this side is haloperidol. Florfenazine. This side, most common drug, chlorpromazine. There are others as well. I want us to talk about side effects, but I wanted to sort of like summarize this for us again. So, when it comes to side effects of these drugs, we talk about the most asked is the most asked side effect is extra, like in the exams, is your extrapyramidal. I think I need to do the physiology around this. Because, yeah, but basically here they're talking about the basal ganglia. But, you know, the basal ganglia, that is where most or all motor movements are planned. They are planned in the cortex, but then executed by the basal ganglia, right? So, and it's not pyramidal. It's not within the pyramids. It's an extrapyramidal tract. So the basal ganglia, the structures that make up the basal ganglia, globus pallidus, your putamen, your substantia nigra, things like that. But I will do a video on that. So it's your extrapyramidal side effects, and it's good to know which ones. Because just saying extrapyramidal side effects is like maybe 1 mark. So you need to understand that there are tremors, there is dystonia, there's akathisia, rigidity, split here, body, which is just it's like slow movement, like when they execute their movements, they're very slow. Whatever movement that they're trying to execute is very slow. I think I will deal with these when I do the extrapyramidal side effects on their own. But for now, it's sufficient to know that when you're talking about extrapyramidal side effects and tremors are the most common. I've seen dystonia in, like when I was still doing peds, I had like 3 kids that took haloperidol. They thought it's sweet. They took it from someone in the family. There's a member in the family who was using haloperidol, so they thought it's sweet. They took it and they came with acute dystonia. Okay, other side effects is tardive dyskinesia. Tardive dyskinesia. So, like we said yesterday, that if a drug is gonna have a high affinity for histamine, for instance, that means that drug will be very sedating, highly sedating drug. Muscarinic, your anticholinergic effects. So these are the side effects, right? Sometimes you use this side effect to your advantage. When the patient has got some kind of insomnia, then you put them on that. Maybe they've got schizophrenia with an insomnia, you can put them on that. And then here you got what they call orthostatic hypotension. You know, orthostatic hypotension is, let's say you're lying flat. When you're lying flat, let me just complicate it. So you're lying flat. If when you stand up, you do that, like suddenly you just stand, like you don't maybe first from lying down you first sit on the bed and then you start walking. If from lying flat you immediately stand up and walk, you get hypotension, because it happens with diabetic patients. And yeah, because your baroreceptors were used to you lying flat, so now it takes them some kind of adjustment to say, oh, now we've got to overcome gravity, we need to stand and walk. Then you get hypotension. And once you get hypotension, you can fall, you can faint, That's what orthostatic hypotension is. So obviously these drugs are gonna give you a lot of that, and we did say that your anticholinergic would be your dry mouth, urinary retention, dry eyes, constipation. So these drugs are known for that. These ones, the plus minus, there are patients who might experience them, there are patients who might not experience them. Even though most of the patients do not get these, but you still need to be on the lookout. This thing, it's the same as, people, they know first generation antipsychotics not to cause metabolic syndrome, dyslipidemia, all those things. But they actually do, but it's not as pronounced, it's not as common as the. So the first generations are known not to be having to cause all these dyslipidemias, all those things. And the second generations are known to cause these problems. But it doesn't mean that it will never occur with first generation. It does occur, but it's very uncommon and all of that. So the other issue is weight gain. Obviously, these ones will gain more weight. This side, weight gain, sedation. What's wrong with sedation? I mean, if you want to work, if you want to drive, you want to play sports, you are busy sedated. It's a side effect. But like I said, you can use this side effect to advantage if you take it at night, things like that. So are you anticholinergic? So if they give you, they ask you a question, they ask you to list the side effects. Sometimes they can say list the extrapyramidal side effects. Then you know that they're talking about it. But if they just say list the side effects of antipsychotics, first generation, you start with extrapyramidal side effects and then mention the others later on. We did talk about orthostatic hypotension. We did talk about weight gain. So yes, we did talk about metabolic syndrome. Let me not call it metabolic syndrome, because metabolic syndrome means that, let me just say dyslipidemia. Some people, so the weight gain, gross weight gain, and also central obesity, right? Dyslipidemia. Another important side effect, very important, is a Granule Cytosis. So Granule Cytosis, granule is a reduction in the granulocytes. Granulocytes are, these are white cells, white blood cells for immunity. The ones that carry granules, they're the ones that have granules in their cytoplasm. And those, I remember from physiology, I used to memorize them and call them BEN. B for basophils, E for eosinophils, N for neutrophils. So these patients, once they get that, and this is one of the things that you need to check consistently when these patients are on these drugs. Not all of them, obviously, but doing that FBC. So once they get this agranulocytosis, once they get this Granule Cytosis, basically they become prone to infections and they die from bacterial infections, right? Maybe I should just leave this, it's fine. It's a metabolic syndrome. Metabolic syndrome, which is increased obesity, like it's central obesity, it's dyslipidemia, diabetes, even hypertension. So those are the things that metabolic syndrome incorporates. So they also get what they call cholestatic jaundice. Not common, but some drugs they do give it. Cholestatic. You will really look smart in the exam when you start making this. So they also get ECG changes due to prolongation. They say this is very, very rare, but when it happens and it's not picked up, the patient can just die suddenly. Sudden death. Sudden death. And then there's also what they call Neurolectic malignant syndrome. Neuroleptic malignant syndrome. It's worth knowing. It's a dangerous kind of a thing, one of the most dangerous. So these side effects, it's a matter of mentioning them, but the ones that you need to sit down and really understand is this guy and this, because of how dangerous this is, and need to know the metabolic syndrome as well. The Granule Cytosis is very important. The anticholinergic is very important. Tardive dyskinesia, these are very important. If you are gonna forget anything, you can forget cholestatic jaundice is fine. Maybe you can even forget the weight gain, but the metabolic syndrome, the Granule Cytosis, because most of the times this is the reason why a patient is changed, because of the anticholinergic effects. Right? So these are side effects, guys. So what I'm gonna be doing, maybe after I've done the second generation antipsychotics, I'm gonna get into discussing the pathway of extrapyramidal tracts, how transmissions are carried out there, and all of that. Yeah. So thank you so much, guys, for watching.